A mother should choose St. Mary's to have their baby. We have a team of people that are well-trained and that really care about patients and about making the patient experience comfortable and making sure that patients get as much care as they need.
For Grand Junction being in a more rural area, we have the ability to provide really high level, high acuity care for women's health. We can respond to any delivery, any emergency, any patient firsthand within moments. That's a really nice resource to have.
We are a level 3 NICU, so we can handle lots of different babies that are born with different issues.
We in the NICU have services for babies that need extra attention and extra care. If you are in a hospital that does not have a NICU, your baby will be transferred to us and you may not come with your baby. Having your baby here at St. Mary's, you will be close to your baby at all times.
We also have a first-rate hospital that has everything and all the resources that a patient may need in any sort of emergency situation. It provides them with both safe care and good care.
The smaller hospitals, as a rule, have great physicians, but they don't have the Neonatal Intensive Care Unit to support the very premature babies. Those things are all available here at St. Mary's, which makes us the referral center for all those complicated pregnancies in the area.
We have just a really great team, people that care for their patients.
To be able to care for moms as they are developing their new family, to care for the whole family unit together. I really love being able to be involved in that. I just feel so privileged and honored to be able to do that for them.